name is Dr. Leyba. I'm a general and robotic surgeon here in Albuquerque, New Mexico. We're going to discuss several things today, specifically regarding patients, how to care for them in surgical wise, and how to make you feel more comfortable. I'm going to see you in my clinic. We're going to talk about things, but today we're going to give you some information so you can process. So when I see you later, we can have a good discussion. Thank you. The reason for making these videos was to help the surgical process along. I've seen it from a surgical standpoint. I know how to do the surgery, I've seen it in clinic and so forth, but I've never really dealt with being a patient. And when patients come to my clinic, oftentimes they're overwhelmed with the amount of knowledge that I give them and other doctors, and they focus on that rather than listening to what's actually going on. So when they go home, their family members ask them, well, what happened? A lot of times they're like, I don't remember anything. So the reason for this is to help educate patients and family members and even providers and other people that want to be involved in the surgical procedures themselves. What is an abdominal wall hernia? An abdominal wall hernia is a hole or defect in the tissues of the abdominal wall. This area is prone to weakness due to prior surgery, acquired over time, or the patient was born with the hernia. There are several types of abdominal hernias, including ventral, incisional, or umbilical. What are the symptoms of an abdominal wall hernia? Symptoms may include intermittent abdominal pain, nausea with or without vomiting, bloating, bulging, and occasional diarrhea. These usually occur after heavy lifting, straining, or standing for extended periods of time and give a dull, nagging ache to the hernia site. These symptoms usually need elective surgical consultation and typically resolve with surgery. Symptoms may improve with laying down and avoiding the precipitating factors. Severe disease, however, may also include intestinal blockage, infection, vomiting, and a non-reducible mass at the hernia site and necessitate going to the emergency department for further evaluation. Strangulation is a feared complication of any hernia. This is a picture that shows the varying degrees of abdominal wall hernias, early stage down to late stage. Basically, a hernia is a hole in the abdominal wall, which we call a defect. You can see here. Sometimes a piece of your intestine can come into this defect and either get stuck or reduce back down. When it gets stuck, it's called incarceration, where the intestine is trapped or incarcerated in this area. When this incarceration progresses, it can actually turn into a strangulation, where the tissue is being squeezed and loses its blood flow and eventually will rupture and cause spillage of intra-abdominal contents from that small intestine. You'll be very sick when this happens, and this is a surgical emergency. Surgery is recommended for any of these defects depending on the clinical scenario, and Dr. Leyba can help distinguish this for you. If you do have a strangulated, or you think you have a strangulated hernia, you should go to the emergency department as soon as possible. Who is prone to an abdominal wall hernia? Abdominal wall hernias can affect both men and women of any age. It is common in men and can be characterized with the 6 M's. Men, manual lifting, muscle straining, multiple surgeries, multiple family members, or a mass or bulge. It is very common in the United States. It is diagnosed on a clinical examination with a clinical history. CT scan may help to rule out other types of disease such as tumors or infections and to further characterize the surgery. The only cure for patients with symptomatic abdominal wall hernias is with surgical hernia repair, usually with a tension-free placement of a surgical mesh on an elective basis. Unfortunately, hernias do not resolve and usually get bigger with time and thus harder to fix as time goes on. Elective surgery is easier and less risky than emergency surgery. How is an abdominal wall hernia repaired? Abdominal wall hernia can be repaired with a variety of methods, including robotically, laparoscopically, or open techniques. Most of my patients go home on the same day and rapidly recover over several days. Each method has its benefits and its risks and are tailored to each patient. I usually do a robotic hernia repair, which entails suture closing the hernia defect, then placing the mesh. The type of mesh chosen is selected for individual patient profiles. Complex surgeries need abdominal wall reconstruction, which can be done with a variety of methods and techniques. Such techniques such as a component separation with a TAR release or endoscopic release are often necessary. What are the benefits of robotic surgery for abdominal wall hernia repairs? As mentioned earlier, I know how to do all of the different techniques of abdominal wall hernia repairs, but I prefer to use a robotic technique for surgery because in my hands it gives me several things. Number one, smaller cosmetic incisions, rapid healing, and a reliable pain profile. Number two, a decreased infection rate in comparison to open techniques. And number three, superior visualization at the time of surgery with the high definition 3D camera, and it's more versatile in terms of surgical arm laparoscopic movements compared to standard laparoscopy. It also gives me the benefit of suturing the defect at any angle during the procedure. Number four, I have the ability to evaluate other intra-abdominal structures such as the intestine or other structures prior to placing the surgical mesh. And lastly, it gives me the ability to suture close the hernia defect prior to placing the mesh. Is robotic surgery safe? Absolutely, it is very safe and is one of the most common surgeries that I do. I have done the most robotic surgeries for abdominal wall hernias in the state of New Mexico. In other areas, it is rapidly growing as the preferred method, especially among minimally invasive surgeons in larger cities in the United States. Not all hernias can be repaired robotically. Some require open reconstructions and complex techniques as discussed previously. What are the risks of surgery? All surgeries have some degree of risk, but surgical risks include, but not limited to, bleeding, infection, injury to other abdominal structures, and hernia recurrence, wound complications. The complications are relatively uncommon and occur more with emergency surgery and long-standing disease, but can be treated if they do occur. Minor risks also include nausea and vomiting, abdominal wall swelling, which typically resolve quickly after surgery. Other things such as atypical scar formation are uncommon. There's an expected pain profile after surgery, and this is usually treated in the postoperative period. Rare complications with mesh implantation can occur and would necessitate removal of the mesh, but this is usually very uncommon. To contact Dr. Leyba, call 505-727-7050 or go to the website at www.lovelace.com/Mario-Leyba-MD.